Hi, everyone. Welcome. Thank you for coming online and asking questions and learning and doing things. I was going to go through a PowerPoint first. That's with us tonight. Brian is running and managing the meeting. He's going to be checking for questions. Professor Cliff Rosendahl, who runs one of the courses in the program, and myself, also one of the course coordinators for some of the subjects through the Master of Medicine. But I'm going to start with a very simple screen share. Like so. Good. So yes, we're talking about the postgraduate skin cancer programs. So it is a postgraduate study rather than undergraduate. We're talking about Master of Medicine, the Graduate Certificate of Medicine, and the third program on offer at the university is the shorter form credential. So starting, of course, with our acknowledgement of country, and acknowledging traditional custodians of the lands which we're meeting, which of course is quite varied as being online. But we pay our respects to their ancestors, descendants, and those who continue the cultural and spiritual connection to country. So universities are big places and they're easy to get lost in. But the good thing for our postgraduate skin cancer programs is ours are all online. It's not a matter of having to come up to Queensland and find your way around a new place or leaving the home. This is all available for you wherever you are currently living is the idea. One of the common questions we get asked about in terms of why do the University of Queensland Skin Cancer Program compare to other offerings for education, which is a very good question to ask. The best way we've found of defining this is we're offering academic education versus vocational training. So to describe that, it's not a matter of here's how you do it. It's here is the knowledge base so you can really understand the subject properly. So it's that difference between knowing a little bit and knowing a lot. And with that academic level of education, you can then work out when to change from the rule book, when you can modify things as required, rather than being told, do the job this way. It is a formal university qualification, is an important part, and that's under the Australian Qualifications Framework. So it's internationally recognised as a consequence. A couple of definitions, though, because these things can be quite confusing to understand sometimes. So a program is the whole of the education you're enrolling into. So you enroll in a Master of Medicine program or a Graduate Certificate of Medicine program. And again, there's formal definitions for PhD or Master's or Graduate Certificate is part of the university structure. And they're a Master of Medicine, even though it's a skin cancer program, the skin cancer part is in brackets. The formal name for it is a Master of Medicine. But within the program, you do courses. So each course is like having a subject, but these are the subjects you choose to study, and you do a number of courses to make up a whole program. So for a Master of Medicine program, you do 8 courses. In a Graduate Certificate of Medicine, you do 4 courses. Now, the tricky part there, of course, is all these definitions. Each course is regarded as 2 units. So as well as saying there's 8 courses, we do 16 units. So you can see how confusing the terminology can be sometimes. But program is what you enroll in, and the courses are effectively each individual subject that you do as you go through the program. So for example, if you were to enroll in a Master of Medicine program, one of the rules is you must be a qualified medical practitioner to enroll. And the second part, which is really important, is you must have access to skin cancer surgical cases. And you need at least 2 years of postgraduate experience from your undergraduate degree to be allowed to enroll as well. So it's not open to everybody. And the reason for having access to skin cancer cases is later in the program, you need to be actually submitting your own surgical cases. So you have to be doing your own surgery on human beings, cutting out lumps and bumps, so you can submit that as part of your assessment. In contrast, for the Graduate Certificate of Medicine, this is sort of often called it half a master's. So it's 4 subjects rather than 8. It's a different qualification, a graduate certificate. This is an undergraduate degree in health, but you don't have to be a medical practitioner. So nurses who want to do more study in skin cancer, pharmacists have enrolled in the graduate certificate. So people who've got a health degree are allowed to enroll in the graduate certificate, and you don't have to be doing your own surgery for obvious reasons, because in that circumstance you're not allowed to. And the final one, which I want to mention, is the shorter form credential, and this is open to everyone. This is actually no prerequisites about having a health related degree prior to enrolling in the shorter form credential. That's the three different offerings we have for the skin cancer postgraduate programs. A good thing to understand is the time required. So people will go and do a weekend course and say, well, what's the bit difference between doing a weekend course on skin cancer and doing your program? Each of our courses is 13 weeks of a university semester, and it's roughly 10 hours of work per week. So 130 hours for a course. And over the whole program, you're going to do 8 of these. So you can understand now the difference in your level of knowledge you're going to gain by being enrolled in a graduate certificate or in a master's program compared to doing a weekend course in skin cancer. You're going to have a really good, solid depth of knowledge at the end of this. So this is something you embark in over a number of years, not just for a weekend, and your knowledge will reflect that, is the idea. Cost is always a very important question everyone asks about. And again, the way that universities are funded and structured is quite confusing. But as a guide for you, they talk about how many units. So all the pricing is listed in units, which is what I mentioned before. And each course is 2 units. So a unit for the Master of Medicine or a unit for the graduate certificate are the same price at $2,490. But there's also the government has stepped in to help us, which is very generous of them. We're very thankful for that. And with the thing called a Commonwealth supported place, which I'm going to explain shortly, that price has been dropped down to $795 per unit. So let's look at some of that. So the fee per unit for a domestic student, the full fee is $2,490 per unit. The international fee is $3,010 per unit. While if it's a government subsidised, which is Commonwealth supported place, it's $795 per unit. Each course, as I mentioned, is 2 units. So you can see the numbers on the screen there about what the cost is per course. And then the different one, of course, is the shorter form credential. And that entire program, the shorter form credential, the entire program is $1,650 plus GST. So again, it's a little bit confusing, the terminology of how universities work, but I hope that makes some sense. And you can always go back to the recording and go over this again if you need to. So what's a Commonwealth supported place? This is where the government subsidises your study by paying part of the fee. And it's not a loan. It's not like your HECS help loans. This is actually something which you don't have to pay back. So all you have to do is pay the gap, so to speak, which is at $795. Who can get them? So it's well listed on the university webpage. You can go back to this and have a look at it. But basically, it's an Australian citizen is who the Australian government's going to pay for obvious reasons. You've got to study while resident in Australia. That's the really weird thing about these government rules is even though you can be online for the entire program, and in theory could be studying the whole thing over in Canada, the rules are to qualify for this, you've got to be resident in Australia, even though you're an Australian citizen. And the same applies for New Zealanders. If you're a permanent visa holder or a New Zealander, you're eligible, but you've got to be studying whilst living in Australia. That's how the government rules work, and it's a matter of we've got to qualify as you do. how does it actually happen? How do you get the Commonwealth supported place? It's again a really weird reverse thing where you have to actually apply to join a program. So you enroll in a Master of Medicine or you enroll in a graduate certificate. And then once you've completed all the necessary paperwork to prove that you're able to enroll, such as you've got to prove you have got a medical degree for the Master of Medicine, you will then get a letter of offer. You then accept the letter of offer, and that puts you into the program. And once that's complete, then you can apply for the Commonwealth supported placement. In fact, it's usually just applied to your fees. So what then happens is in the back end of administration, they say, good, here's a person who's correctly enrolled in a program and they've applied to start this course. Therefore, that they get the application. So the invoice you receive to pay for that particular course will have the corrected fee for you. So there's a bit of paperwork extra to do, not a lot, and it's all fairly evident as you go through the enrolment program, but it makes a big difference to the total fees required. The other nice thing with the Commonwealth supported places is that they apply for the entire life of your study. So they are at the discretion of the government, and it could be that in 2025 or 2026, they might say, we no longer are offering Commonwealth supported places for this program, but they do apply at the moment. And if you apply to join the program, get accepted, enroll, and then get off at a Commonwealth supported place, that will cover you for the entire time it takes you to do your course, or to do your program, should I say. So let's have a look at what's actually in some of the programs. I've got Cliff to talk to his subject, IMED 7001. You'll get used to some of these names of subjects. But this is effectively the introductory course for the program. I'll hand over to you, Cliff.
Thanks, Tony. Can I just ask a question to clarify in my mind first? The $795 you mentioned with respect to the Commonwealth supported places, is that what you pay or what they contribute?
That's what you pay at the end of the day.
That's pretty good
per
deal, eh?
unit. So think of it 800. So it's $1,600 per subject or per course.
It makes it really, really affordable compared to the past.
Oh, if you compare it to something like doing a Masters of Business at Harvard, which is over $100,000 to do it, it becomes a very relatively a cheap course compared to other things available.
Right. Yeah, okay. Well, I'm happy to talk about my course, which is the introductory course, as Tony said. It's meant to get you a good foundation of knowledge in the diagnosis and management of skin cancer, and also with respect to things like ethics and dermatopathology, basic surgery principles. So it's really a foundation for all of the courses that follow in the graduate certificate and the master's program. And so it's a compulsory one, and it's the one that you should do first. There are 13 weeks. There's a week off in the middle, but there are actually 13 teaching weeks. And we start off talking about the history of skin cancer and the history of skin cancer management. We talk about embryology of the skin and how that impacts cancer development. For example, we talk about things like what caused pale skin to evolve and what caused darker skin phenotypes to evolve, the pressures to do with vitamin D, folic acid, this type of thing that influence the advantage of whether you've got fair skin or dark skin. And we talk about melanin synthesis, the process by which melanin is manufactured in the body, and for what purpose it's manufactured, and where most of the melanin resides. That's the pigment in the skin. And you might think, well, most of the melanin would be in melanocytes because that's where it's made. But actually, most of it is in keratinocytes, even in fair-skinned people, because that's why it's made. It's made to protect the other skins apart from the other skin cells apart from the melanocytes. Now, After that, week 1, we go into week 2. We look at the microanatomy of the skin. We talk about, again, melanin and melanocytes and whether something's melanotic or melanocytic. It's very, very important to understand the structures that are in the skin. For example, you might have a melanoma in situ, which is confined to the epidermis. But when you know that the hair follicles can penetrate right down to the fat, and that the melanoma in situ can line the epidermis of the hair follicle, then you realize that if you cut out a melanoma and don't take all the fat, that melanoma can come back from the melanoma cells, melanoma in situ cells within the hair follicles. So microanatomy, you learn what types of blood vessels you can see through a dermatoscope. You learn how deeply you can see with a dermatoscope. For example, a dermatoscope is just a low-powered microscope. Instead of looking at a vertical, minute section of skin, like 3 millionths of a metre in diameter, and only looking at about, with a normal conventional microscope, the pathologist sees about 1% or less than 1% of the actual lesion. With a dermatoscope, you're seeing all of the lesion to a depth of about 1 millimetre. And all of the action that decides whether something's a melanoma or a nevus, or whether it's a basal cell carcinoma or just normal skin, that's all in the first millimetre of skin. So it's a very powerful tool, the dermatoscope. So in week 3, we talk about sun protection. We talk about oncology, a little bit of understanding of malignancy. Then we go on to epidemiology in week 4 and how to do a skin clinical examination. And we talk about the Skin Cancer Audit Research Database, whereby you can track your lesions and assess your performance. So you can see all these columns of one on science, one on diagnostics, one on surgery, one on research, one on ethics. And as we go down, we move more to the right. So week 4 with the epidemiologist clinical examination is SCARD. We're covering some research. We're covering how you actually examine a patient. And week 5, we move more into diagnostics, introduction to dermatoscopy, and the various algorithms that have developed over the last 30 or 40 years, and how we can evaluate algorithm to see what one's better than the others. And then in week 6, the language of revised pattern analysis, which is the language that I teach for describing structures in the skin of relevance to diagnosis and things that you can see with a dermatoscope. In week 7 and 8, we have 2 weeks to talk about pigmented skin lesions and an algorithm for diagnosing pigmented skin lesions. Week 9, we talk about non-pigmented skin lesions, how to diagnose them. These are decision algorithms to tell you what to do as a priority against what it actually is. Whether to cut it out or not is the most important decision. Week 10, it's pathology and how you correlate what you see through a dermatoscope to what the pathologist will see through his microscope. Because if you can build up a mental image in your mind from your dermatoscopic microscope, you can actually predict what the pathologist will see, and you can make a very accurate provisional diagnosis based on your skin microscope. Week 11 is core surgery. Obviously, surgery is dealt with in depth in courses further down, including the one which Tony teaches. And then a week on core research, mainly so you can understand the language of papers about studies, like p-values, confidence intervals, how to write a basic case report on an interesting lesion that you might find. And finally, ethics and professional behaviour as a skin cancer practitioner. And with every single week, it's clearly marked out in this column here what the prescribed reading is. So once you've decided to enrol in the master's or the graduate certificate or the short form credential, you can start reading now. You don't have to wait till you start your semester. You can start reading now. This tells you there's 2 books. The course textbook is one that I compiled from other material or referenced. and that was originally the textbook, and now we have a book called Dermatoscopy and Skin Cancer, a handbook for hunters of skin cancer and melanoma. I don't know if you can see that there, but that's the course textbook. And all of the stuff that you need to learn is in there. Now, as far as assessment of my course, each week there is a quiz. It's an open book quiz. You can consult. You only have an hour to do it. And that counts for a fair proportion of your marks. There are 2 assignments, one in the middle of the semester, one at the end of the semester. They're open book. You can consult whatever you need. You have access to the first one from the first day of the semester. You have access to the second one straight after the first one is submitted. And then there's an exam at the end, which is a 70-minute multi-choice question exam, and that's the assessment. Each week there is a blog where I put up some questions and some case, and I structure it so it's relevant to the week that we're doing, and you're required to do a response to that by the Wednesday night, 7:30 p.m. And then at Wednesday night every week we have a face-to-face Zoom meeting that you can attend and talk to me and all the others. And there are actually 14 of those throughout the semester. If you can't watch them for personal reasons, it's the middle of the night in the country where you're at, then there's a recording which you can then watch and submit a short summary to show that you watched it. So we have a lot of fun in this course, and this last semester has been a record enrollment. It's been great. And with respect to my other course, the short form credential, that's for anybody. You don't need any qualifications. A lot of nurses do it. Some doctors do it to put their toe in the water. It's the first half, or the diagnostic half of this. So it concludes week 1, week 2, week 6, week 7 and 8, week 9, and week 10. So it's the dermatopathology, the non-pigmented, the pigmented, the science of skin cancer, and it's in 5 modules. So and that's only $1,650 all up, and it only requires 5 hours of commitment per week, all flexible in your own time, instead of the 10 hours for this course of core knowledge and professional practice. So I think I've probably spoken long enough. Does that about cover it, Tony?
That's perfect. Yeah. That's the thing. So you can just see from this one course, which is only one course out of 8 you do for a Master of Medicine, or one course out of 4 for a graduate certificate, you get a huge volume of knowledge. Your brain starts exploding as it fills up, but your core knowledge, your base you're working off, is so much better, because you're going to have 130 hours of knowledge just there from one of the courses. And you keep on adding to that. So you can see that the depth of understanding you finish with when you've completed a master's. And therefore you can feel confident with what you're actually doing, is the nice thing. So other courses, there's other stuff on demoscopy as well. So the second course, IMED 7002, is virtually all about demoscopy and diagnosis. So while Cliff's taking you through a whole lot of stuff about the introduction and that real foundation stones, you then get to build on that. So the second course is really in-depth demoscopy the whole way through, lots of diagnostic issues to consider. So you get a real good feel for what you can find on the skin. And then later in the program, we get to something like what I teach, 7011, which is a therapeutics one. So this is when you've done a lot of these subjects already, and this is the ones that you need to be a medical practitioner to do it, because you need to be doing your own cases. But when you're doing your own cases, it's just simple ellipses are quite okay. So some of my students are submitting quite complex flaps and graphs as part of their assessment, which is great. And we get to talk about these things. Well, as Cliff mentioned, we do a lot of online meetings, and you sort of form a cohort, and often that cohort roughly goes through together. So you create some great friendships with people throughout the whole program, and you start discussing these things with each other. We have these discussion boards, which are really well used. You can see there's 336 posts just on the surgical cases there. The non-surgical had 103 posts. This is only partway through one of the semesters. So there's lots of interaction, lots of discussion about a whole lot of things in every one of the courses. Basically, same sort of structure as what Cliff was showing you. For the advanced therapeutics, we focus more on managing diseases at the start. So we talk about the overall management of melanoma and all the different ways of doing that, the overall management of solar keratoses, all the options, squamous and basal cell, talk about some of the rarer tumors and management of those. But then we start looking back into the how do you manage complications? What can you do for prevention and reinforcing some of those things? So again, for the therapeutic side of things, you cover a really good in-depth volume of knowledge to feel comfortable and confident about managing a person with a skin cancer. And as Cliff mentioned, we have these online tutorials. So we catch up with each other, we get to know each other and discuss all these things. And that makes a big difference, this collegiate interaction where you'll start learning as much from your colleagues as you learn from the course. And you can start discussing all the nuances of everything else. So there's also obviously an introduction therapeutics course. There's a clinical cases, which is diagnostic. There's a course which covers photography and monitoring, as well as skin cancer genetics. There's a pure research course. There's a whole lot of things you get to choose, and there is options you can take. Some of them are compulsory, such as what Cliff teaches for the first course, but others are optional in terms of what you decide to take in your master's program. But I'm going to stop there and see if we have any questions from people who are online at the moment.
We don't have any questions yet, Tony.
There's
But
a
yeah, so
chat
we
section
are,
there, isn't there?
yeah, we are going to take questions via the chat. So if you do have any, please can you pop them in there, or you can come online and ask out loud if you prefer.
We've educated them all so well, Cliff, that they've got full knowledge now. That how it works. Good, Lee. So the master's being a 2-year program, the maximum time technically is 10 years. Now, no one takes 10 years to do it, which is a good thing because there's obviously evolution of things throughout the 10-year period. But technically, once you have completed a course, if you completed Cliff's course of IMED 7001, it's valid towards your program for a 10-year period. On average, people take 3 to 4 years to get through the program. So you can get it done in 2 years. And technically, you could do it in 1 year, but no one does that.
Yeah, that's not quite right because it's a part-time course, obligatory. So
Yeah.
2 years is the fastest you're allowed to do it.
Yeah. So people do 1 or 2 courses per semester. And if you do 1 course per semester, that's going to be 8 semesters or 4 years to get through the program. While others will get through fast, get through it in 2 years. There's only 2 semesters per year. There's no trimester, unfortunately, Mark. So it is 1 semester starts late February and the next semester starts late August. So our next time we can enroll is going to be starting in 2 months' time, effectively. So we've just finished our exam period for the last semester. And I think enrollments are open now for next semester. There's a question about knowing being approved. You'll get the email from the admissions, basically, Deepak. Have I missed any questions there, Cliff?
It's a heap of questions there. One is the master's a 2-year program is a maximum time frame. You've covered that. When will I know I've been approved? That's when you'll hear back from on a case-by-case basis when you've submitted all the stuff. You'll hear back from administration. Is there a semester clinical examination? You want to answer that one, Tony?
So most of the courses have a exam at the end. Some of them don't. So I think there's, of 8 subjects that you do, 8 courses that you do, I think it's 5 of the 8 have an end of semester examination. And
Now,
again,
Zion has asked about a clinical examination, so I guess that means in my course, there's certainly a section on clinical examination. There's a video that you can watch. It's available in my course. It's also available on the Skin Cancer Education Hub, which Brian can share with you if you haven't already got it. How I actually do a skin cancer examination. So, and the other courses also, I think, Tony, 7002 and 7003 cover clinical examination and clinical science.
the question might be related to doing like an OSCE type exam. I'm not sure. So there's no face-to-face exams, if that's what the question actually is, in terms of you don't have to actually physically come in and demonstrate you can.
That was Zayed who asked that question, so you might want to clarify what he meant there if we haven't covered it.
Yeah.
And then the next question is regarding the master's program. Do we need to do extra surgical courses to improve our surgical skills?
No. So again, this is that vocational training versus academic knowledge. And so we encourage you to do other surgical courses as well, but we're not doing any mentoring surgically. We're not sort of standing with you one-on-one and making sure you're doing it correctly. Again, it's designed to be all online, so you can do it anywhere in the world. And to make that possible also means that we don't have to do a mentorship or preceptorship.
In my course, I do give very specific recommendations as to how you might get surgical experience. So that's one thing I cover, and it seems to be very satisfactory. People take up that advice. The question there, are all courses within the program Commonwealth supported or only certain courses? And is there a research component?
Yeah, so they're all covered by the Commonwealth supported places.
Except the short form credential.
Except for the short form credential, which is like a separate program, I suppose. And yes, one of the courses is a research-based course. It's not a compulsory one to do. And the general guide is most people doing the program are clinicians seeing patients day to day. And we want you to, at a master's level, to be ready to be able to do some research, in particular clinical research. So you can have some interesting findings in your clinic and then be able to evolve that into research projects. So I've currently got 2 PhD students who have finished the master's program, have had an interesting question, have got the understanding and interest as a consequence of that particular subject, and they've taken that further to enroll in a PhD program for a full-on research question.
So there's a question there about the book that I talk about. This is the book. It's Dermatoscopy and Skin Cancer, a handbook for hunters of skin cancer and melanoma, and it's published by Skion. And you can get it, I believe, at the University Bookshop, or you can get it from there are several distributors in Australia, but it's certainly you can actually get it from the library, and you can get it from Amazon. And so I'm trying to think of the name of the distributor, but I think it's Woods Lane.
Tony, can you put the book up again? Because I could see it on your screen, but you weren't on camera. Yeah, that's it there.
Yeah, so you get from Woods Lane, Lane in Sydney, a distributor. They can get it to you pretty fast.
And if you're really nice, you'd even get Cliff to sign it. A personally signed copy from Cliff.
You're worth a lot when I'm dead.
Now, there's a question also about the surgical cases logbook. Yes is the answer. So we use the SCARD database for recording surgical cases. For my subject, when you're submitting cases, you're submitting 4 cases for that. For the subject 7014, I think it's a minimum of 30 cases you submit as part of the surgical log. So we do use the SCARD database for logging surgical cases you do.
The question there is about grafts. I don't think you have to do a graft to register, do you, Tony?
No, no,
Surgical cases.
yeah.
Elliptical excision biopsy is all you're actually, I think, required to do. Is that right?
Yeah, so we didn't set the bar too high because there's some people who really want to focus on doing skin cancer diagnostics. We didn't want to exclude those people. So we encourage you to do flaps and grafts and those sorts of things, but it's not a compulsory part of the program to do them. So if you're just doing simple ellipses, yes, that's enough to complete the program.
The question here, I didn't receive an email confirmation of my application to enroll. Is this normal? Do I have a problem with receiving emails from you? I didn't get an email confirmation for this webinar on my initial registration either. I don't want to miss important correspondence. So that's a good question from Tim.
I've just messaged him asking him for his email address, and I can follow it up with him.
Fantastic. Thank you.
Excellent. No, we don't want communication breakdowns. That'd be no good at all.
Now, another question, any subjects from other university will UQ accept as recognition of prior learning?
There is, yes. There's actually a what's called a credit precedence database. You just got to love university terminology, don't you? So you can actually go online and type in for any particular subject or any particular course and say, is there any precedence that's already been set for some of these? So there is, for example, with the demoscopy program, IMED 7002, if you've completed 3 of the health cert demoscopy courses and completed all the other associated learning for it, that's got recognised credit precedence for that particular subject. But again, the best way to think of it is, was your previous study equivalent to 130 hours? Because people have said, oh, I've already learned how to do this. I did a weekend course somewhere. Why am I studying this as well? And it comes down to the volume of knowledge. But credit precedence comes down to, is there a 75% equivalence in what you're learning from the previous course you've done and what our course is? And is there an appropriate university level of examination of that learning? Is probably the best way to describe that.
There's a very good question here. Can one start with a 1-year course, which I guess means the graduate certificate, and later on, if you decide to pursue the master's program, do you get any recognition of prior learning from having done the graduate certificate?
Yes, you can. It's more, you can't get 2 awards for the same study. So if you started with the graduate certificate and you did the first couple of subjects and then thought, you know what, I want to upgrade to the master's, then those previous subjects you've done count towards your master's. So yes, you can do that. You can start with a graduate certificate and then upgrade to the master's. It's a fairly straightforward application process to upgrade as long as you're qualified for it.
If you've done the graduate certificate, that is the first half of the masters. So if you've completed the graduate certificate, then you roll the masters, you've already done that half of it. You've only got to do the second half.
Yeah. So that counts quite safely for both. I'm a dermatology nurse doing nurse practitioner course with other uni. All about credit certificate will help. Yes, it will. So we've actually been speaking to University of Queensland Department of Nursing about that exactly for the nurse practitioner course that they have. So that's the sort of thing where if you did some of the courses in the University of Queensland graduate certificate program as a nurse, then you should be able to request that they be included as part of your nurse practitioner program. Now, they may not accept that, but certainly it's going to be very useful for nurse practitioners who want to go into skin cancer, because most of the other nurse practitioner courses don't cover that at all.
Another question here, Tony. Does UQ still offer the advanced surgical head and neck course?
We don't, as far as I know. There was an anatomy course on that. It's not with us, as through a different department. Was through one of the anatomy departments, but I don't think it's available at the moment.
think you've answered the question about the dermatology nurse who's asking if the graduate certificate will help her, and that would certainly be a yes. No question.
And then one of the skin cancer college courses count for recognised prior learning. Yeah, so again, it's the advanced dermoscopy and advanced skin cancer medicine is recognised prior learning for, I'm testing my memory here. I think it might be 7002, but it might be 710. So
There's a question that's reverse of that. Does completing the Masters help in obtaining a fellowship with the Skin Cancer College of Australasia?
it does, yes. Because one of the requirements for the fellowship of the Skin Cancer College is you've got to have the education component. And the Masters has been recognised as covering all of your education components. Now, you still have to also do their OSCE exam, and you have to do their surgical case requirements for fellowship. So yes, I've done that. I'm a fellow of the Skin Cancer College, and so as well as my education base, I had to go and submit the surgical logs and do the OSCE exam. In fact, I think you were examining me, Cliff, in my exam, as I recall. You were
Can't
trying
remember.
to hide. You were trying to hide a lesion under a band-aid, as I recall.
Yeah, and you actually took the band-aid off, so you passed.
I
Otherwise, you would
passed,
have failed
exactly.
miserably. There's a question here. I think I don't know if you covered it. Do Skin Cancer College courses count for recognition of prior learning, and do health cert certificate courses? And I think it depends on the course you've done, doesn't it, Tony? It's whether you get recognition of prior learning in our program.
Correct. That's where the credit precedence database explains which courses you have to do and what they line up with. I haven't got that detail in front of me, but it's online. You can type in University of Queensland credit precedent database, and then if you just type in skin cancer, you'll find all the relevant things for that to say which ones line up for what. But again, I think the big comparison is each of our courses is 130 hours. And so the 6-month skin cancer college course is equivalent to that, for example. That's about a 130-hour course. So that advanced skin cancer medicine course is equivalent to one of our subjects, one of our courses.
I think we've answered all the questions.
We've done very well. I bet everyone's found that useful. And obviously keep on sending in questions via emails afterwards. And those people who are watching this online, making contact by email is the right way to go as well. What's our best email contact, do you think, Brian? Do you want to go through you?
No, I can put the inquiry email address. I'll quickly find it and I'll pop it up in the chat. And I guess the other important date that I put into the chat is the application deadline for semester 2, which is the 16th of June.
Oh, 16. That's only 2 weeks away.
Yeah, so it's not far away.
Oh, it is too. Okay, yeah. So if you go online and search for Master of Medicine Skin Cancer, you'll very early in the search find the listing for University of Queensland. And on there, you'll see the Apply Here button. It's a fairly straightforward thing to then follow through to be able to find how to apply. The actual process for applying is complex. We have to follow university rules. There is med.inquiries@uq.edu.au. What Brian's posted up there for us. Fantastic. Yeah, so it's important that we have to follow not just our faculty rules, but university rules across Australia about what's required to apply. And you can start at either semester 1 or semester 2. So definitely Cliff will be there teaching in, what is it, a month and a half before it starts again for semester 2, doing IMED 7001. So we'd love you to come and join him for that.
And I guess if you're interested in doing semester 1 next year, the deadline for that one is the 16th of January.
Okay, good. Any other final questions that people might have? That's looking really good. We've been a very civilized 45 minutes rather than going overtime. It's very unlike us, isn't it, Cliff? We normally tend to talk for hours. Thank you all very much for coming along this evening. I hope you found that useful. And please do contact us if there's any further questions that come up, or those who are watching this online. Yes, use the email address to make inquiries as you need to, but be conscious of that date of 16th of June. It'll come up very, very quickly. So I'd get onto that quite soon.
Great.
Thanks very much.
Thank you very much.
Thank you all.
Bye.
Bye now.